Hi guys. So today we're going to talk about glioblastoma multiforme. This is a type of brain tumor and it's a type of astrocytoma. So yeah, if you haven't seen our previous video that talks about astrocytomas, you can pause now, go back and watch that. So glioblastoma multiforme is also known as just glioblastoma. It's also called GBM or grade 4 astrocytoma. So let's get into this.
Yeah, so what actually is a glioblastoma? So this is a very fast-growing and aggressive brain tumor. And glioblastomas are also always malignant. We talked about that term in the previous video that covered the general characteristics of brain tumors. Do you remember what that means? So malignant basically means that the tumor grows both bigger in its current location and it also spreads to other areas. And in the case of glioblastomas, they typically grow and spread within the brain, but they don't really spread to other parts of the body. So glioblastomas can either begin de novo, which means that they begin just as they are, which is really nasty and aggressive, or astrocytomas, which is a type of slower growing, less aggressive tumor. And they can evolve to become glioblastomas as they become more aggressive and fast growing. So this is why glioblastomas are often referred to as grade 4 astrocytomas.
Okay, next question is, who does this affect? Glioblastomas are actually the most common type of malignant brain tumor. Remember, this doesn't mean that they're the most common brain tumor overall, just the most common brain tumor that grows and spreads. And here's a couple of basic statistics about how common they are. 47.7% of all malignant tumors, brain tumors, are glioblastomas. And there are a total of 14,000 cases every year diagnosed in just the United States. And glioblastomas can occur in anyone, but there are certain risk factors that make someone more likely to develop a GBM. Some of these risk factors include being male, being over 50 years old, the median age of diagnosis is about 64, and there's certain genetic abnormalities. We won't go into the details here. It's just important to know that sometimes there's a genetic factor to developing a glioblastoma. Also, previous radiation exposure, typically used to treat a different kind of cancer, can make you more likely to develop a GBM.
So now we want to know where exactly glioblastomas grow. And it turns out that they can grow anywhere in the brain or spinal cord, but there are certain locations where you're more likely to find a glioblastoma. Typically, they develop in your cerebrum, which, if you'll remember, is the big front wrinkly part of your brain. And this is responsible for most higher order brain functions, like thinking, deciding, emotions, perception, memory, and many more. But you can get even more specific. You're most likely to find glioblastomas in the frontal or temporal lobes of the cerebrum. And at this point, I'm pretty sure you've talked about the functions associated with the different lobes of the brain. So let me ask you, if you have a tumor growing in these two areas with, like, what brain functions do you think this could disrupt? What sort of symptoms might this cause? So we're going to talk about this in a minute, but pause the video if you want to try and come up with some possible symptoms based on where the tumors are typically located.
Okay, so now we have a diagram of the brain. And if you recall, the whole colorful area, the wrinkly part is the cerebrum, which we said glioblastomas are most likely to develop here. But now, can you point out which of the 4 smaller lobes that the glioblastomas are most likely to develop in? Remember, it's frontal and temporal. First, we're going to look at the frontal lobe, as you can see in indigo. And let's do a quick review of the functions of the frontal lobe, because this can be very important for the symptoms that a patient experiences. The frontal lobe is responsible for lots of functions, but some of these include voluntary movement, speech and language production, attention, concentration, planning, problem solving, decision making, and many more. So you have a tumor in this area, it might mess with these processes. Maybe it'll make it really hard to concentrate, or maybe it'll make your personality change all of a sudden. But because there's such a huge range of functions of the frontal lobe, there can be a lot of different symptoms that arise from a tumor in this area. Now let's look at the temporal lobe, which you can see in green. If you remember, it's responsible for some visual perception, understanding language, auditory processing, recognizing and processing emotions, and certain inner drives like the need to sleep or being really hungry. And there are a lot of other functions associated with the temporal lobe. So a tumor in this area might produce symptoms like visual changes, maybe blurry vision. It could cause mood swings, sleep disruptions. Maybe you have trouble falling asleep at night all of a sudden, or you can't stop falling asleep during the day. Changes in appetite, and this could go from eating way, way more than normal to hardly eating at all. So I hope seeing this visually helps you understand exactly where in the brain these tumors are most likely to be located and how this might affect some of the symptoms that they cause.
So now let's look at some overall common symptoms. And as you go through this list, you'll see that some of these symptoms might be associated with one of the particular lobes that we just talked about. But some of these can also arise regardless of where the tumor is located. Also, keep in mind that these are just some of the common symptoms seen in patients with glioblastoma. Because of how complex the brain is, there are many, many more symptoms that could be caused by a GBM that aren't listed here. The range is so big. So let's start with persistent headache. This is common when it comes to any kind of brain problem, not just brain tumors. There's also vision changes like double vision or blurred vision, and also vomiting because your brain controls sensation and digestion in your gut. Then we have loss of appetite, which can be linked to a function of the temporal lobe, mood and personality changes, and changes in cognitive functions. Here we have some frontal lobe territory. So there's also new onset seizures. This isn't a symptom if you've had seizures before the tumor. Also speech difficulty, balance and coordination problems, and also changes in sensation. And while some of these symptoms might seem kind of vague, like how I kept just saying changes, remember that's because there are so many possible changes that could happen. For instance, mood and personality changes. You could become less social, more irritable, decision making is more difficult, and many, many more.
Okay, so now you know a lot about glioblastomas and just how dangerous they are. So it's really important that we're able to detect them early so that patients can get treated early on. But how do we actually figure out that someone has a glioblastoma? Because there's such a huge variety of symptoms and few physical changes like that you can see on someone, detecting brain tumors in general can be really difficult. But detection almost always starts with a discussion with a healthcare provider, such as your primary care physician. This is why it's really important when you go in to talk to your primary care doctor that you're really thorough, because maybe you don't think that your loss of appetite is related to difficulty concentrating, but these are trained healthcare professionals and they could make a connection that you don't see. Okay, but this conversation can't actually diagnose a glioblastoma. It's just gonna raise suspicion of a brain tumor or some type of neurological problem. From there, we have to go to diagnostic imaging. And here we have a bunch of acronyms. Well, not acronyms. They're all different types of imaging, and they stand for very long and complex terms. MRI is magnetic resonance imaging, CT, MRS. That's not really important. What's important is that all of these methods are ways of visualizing the brain and actually seeing the tumor. This is how you know for sure that you have a brain tumor. And these images can provide certain information to doctors like size, location, certain properties about the tumor. But that's not all. There's also other tests that can give doctors more information about the type of tumor, so specifically a glioblastoma, and properties that might help them figure out how to treat it. So these include a needle biopsy where they go in, they cut out a little piece of the tumor, and then they run tests on it, and other types of blood tests. This is the general process for realizing that you have a brain tumor being diagnosed as potentially a glioblastoma and learning more about your diagnosis, the exact progression of the tumor.
Yes, so once you know that you have cancer, there are a wide variety of treatments. And creating the treatment plan for each person, this usually requires many medical professionals across various departments and specialties. This is because the treatment plan can depend on many different factors, including age, your overall health or health conditions, where the tumor is located, how big it is, and other characteristics of the tumor, as well as what the patient wants to do. So there are two different types of treatment, and this is usually important when it comes to very bad and deadly tumors. So there's palliative care and active care. So palliative care means that you aren't actually treating or trying to get rid of the cancer or the tumor. You're just treating the patient's symptoms and trying to improve how they live, their quality of life for the time that they have left. So active care, on the other hand, is trying to actually treat or like shrink that tumor, and it's not just focusing on the symptoms that the tumor is causing. So since glioblastomas are very bad and very aggressive tumors, and they don't really have very good survival outcomes, patients may choose to accept that their cancer is deadly and instead make the most of what time they have left, especially because active treatment can often be really difficult and it can negatively affect your health in other ways. You might be really tired, very lethargic, and you might just feel very nauseous. Okay, so however, when it comes to active care, there are many options to consider. There's surgery, chemotherapy, radiation therapy, and also a very wide range of medication. So usually each patient has a special treatment plan that includes a couple of these forms of active treatment. Okay, so now that we've covered glioblastomas, we hope that you enjoyed this video and that you check out our other videos on brain tumors. Thanks for watching.
Thanks, guys. Bye.